You'd mentioned something about telehealth earlier. Tell me about that.
So we have had a long-standing partnership with our telehealth partner at Mdlive that provide a number of virtual options for our members. We started this partnership with virtual urgent care, with really the idea being to try and keep people out of the ER for things that they don't need to go to the ER for. So things like a cold, a flu, things like urinary tract infections, migraines. We see a lot of our members go to the ER for those sorts of conditions. All of those conditions can be treated and triaged by Mdlive at a significantly lower cost. For example, in the state of California, our average visit to the emergency room for like an MRI, for example, is about $2,400 per year. If that same member were to use Mdlive in place of the ER, the plan cost that CVT would pay for that same treatment or that same visit is about $50 as opposed to $2,400, right? And we've incentivized members by eliminating what we call cost share, or the cost that a member has to pay out of pocket when they go for care. So typically, if you go to the emergency room, you're going to have an emergency room copayment. That goes away if you use Mdlive. If you're on a plan with a deductible, you have to satisfy the deductible amount. That goes away with Mdlive. So it allows members to get care faster. You don't have to sit in a crowded ER, and you keep money in your pocket by not having to pay a copayment or a deductible for that care.
Is it just urgent care?
No, we've actually layered in a number of additional virtual benefits as well, starting with virtual behavioral health. So getting in to see a psychologist or a psychiatrist in a brick and mortar building these days is virtually impossible. So adding a virtual option has really expanded access for our members, where they can see board certified psychiatrists and psychologists and work with those folks on a regular basis as needed for their behavioral health needs. And again, we waive the member cost share component associated with those virtual behavioral health visits. We've also layered in virtual dermatology as well, where if I've got a rash, I can take a picture of that rash, upload it to my Mdlive profile. The dermatologist takes a look at it and says, "Yep, Jeff, you've got eczema. Here's what we're going to prescribe." Sends the script to the pharmacy, and I pick up my prescription, and then I'm off and running. That dermatologist can follow up with me and make sure that things are improving as expected. And then recently, we have added virtual primary care through Mdlive as well. There is a shortage of primary care physicians in the state of California, and Mdlive again opens access in a really significant way to members to have a virtual relationship with a primary care physician, a relationship that can be ongoing with the same provider who gets to know you, your conditions, the things your goals, what you're struggling with, and can prescribe medications, can order lab tests, can refer you to specialists, all the things that a typical brick and mortar primary care physician would as well. And again, in all those cases, the member cost share is waived, so you can keep money in your pocket.
It sounds amazing, especially given the fact that you had mentioned there's a shortage of primary care physicians in California. If our members are in certain parts of the state where they're in a primary care provider desert, this is a great resource for them to use.
It's a great option. It's an absolutely great option. And our goal now is to try and make members aware that this is available to them. It's new. It's only been out and available to our members for a few months now. So our goal now, our effort now, is to really help make them aware that this option is available to them.